Dangers of pyelography. Pyelography is a dangerous procedure. A number of deaths have been reported as resulting from it, and many more are unreported. Pyelography may injure the kidney in two ways. One, at the moment of injection, it may be driven into the kidney parenchyma, either by the force of the injection itself or by the reaction of the kidney colic excited by the injection. The fluid is driven into the lymphatic and blood vessels about the kidney pelvis. Thence, it radiates through the kidney itself, making cone-shaped infarcts characterized by acute inflammation and degeneration. Thence, the color gall is carried into the general circulation and excreted, both by the glomeruli of the injured kidney and that of its fellow. Thus, in the injured kidney, color gall may be found in the tubules and glomeruli, but only if the lesion has existed for a sufficient length of time to permit excretion to begin. Figure 38. Figure 37, normal kidney pelvis. Note visible catheter extending to upper calyx. Figure 38, damage done by pyelography. Microphotograph from figure 39, showing color gall in glomeruli, tubules, and stroma. Figure 39, damage done by pyelography. Color gall infiltration of parenchyma of hydronephrotic kidney removed 2 days after injection. Visible catheter points directly toward the shadow. Figure 1, patient complained of pain in the hip. X-ray showed a suspicious shadow on tip of transverse process of fourth lumbar vertebra. Ureter catheter always stopped at 15 centimeters. Wax not scratched. Renal function perfect. Diagnosis, no stone. Figure 2. Confirmed by injection of color gall, which showed a kinked ureter, remote from the suspected shadow. Two, secondary or late infiltration may occur even without the slightest pain at the time of injection as a result of obstruction of the strictured or kinked ureter. On account of these dangers, the following rules of technique are absolute. Technique. 1. Pyelography should never be performed excepting upon a patient in a hospital, so that if acute renal retention follows the operation, the kidney may immediately be drained. Figure 39. 2. In order to minimize the danger of renal retention, the patient should lie upon his back for at least 12 hours after the operation. 3. Advanced renal retention gives the most beautiful pictures to pyelography, but this condition can be diagnosed very accurately without pyelography, and it is in this class of cases that the operation is most dangerous. 4. Pyelography is relatively safe and eminently useful in the diagnosis of tumor, stone, small hydronephrosis, and sometimes in tuberculosis. 5. The injection should always be made by gravity with the container not more than 2 or 3 feet above the level of the patient's body. 6. The capacity of the normal kidney pelvis may be as little as 2 or 3 cc's, but usually 5 cc's may be injected with impunity. It is wiser never to inject more than 10 cc's. Leaving the catheter in to drain off the fluid is scarcely worthwhile unless there is ureteral retention.